in Europe. Well, Europe is a big economical and geographical and climatic and cultural and language-wise very complicated place to talk about. So the natural health ideas, ideas of natural health encompass the harmony with nature, with so it depends on the climate and on the flow of the seasons. Also, people have learned over generations through trial and error how to what to use for their for maintaining their health, for improving their health, and for treating some ailments. These things have remained, have been transmitted orally from teacher to disciple or from mother to daughter, and also what we have now are medieval manuscripts which are being revisited, and also the principle of like cures like, which has been known since Hippocrates, but Simon Hahnemann has scientifically proven it through many provings on humans. And of course, in the 20th century, with the discovery of antibiotics and the evolution of chemical pharmaceutics, plant-based medicine, as I should say, natural medicine, has come into decline. But now, due to various reasons, it is continued and revived, and leads to the concept of integrative medicine, and legislation regulating it is very various in different countries. So what has been used, or what is being used in health and healing from nature is plants and phytotherapy, mineral waters and hot springs, simply the air and the climate in mountains and forests, and the sea waves. Also, prayers, superstitions, traditions have a great influence on people's mental health. Diet and fasting, and more recently a combination between herbal therapy and modern pharmaceutics is the science of Gemmotherapy, which uses extracts from buds of trees and shrubs, also healing rocks, minerals, crystals, and so on. So talking about each of them briefly would be, interestingly, the difference between phytotherapy and herbalism. Phytotherapy is the science-based medical practice proven through clinical trials of isolated compounds, and this is based on the modern science. However, herbalism relies on the empirical appreciation of medical herbs linked to traditional knowledge, and the herbs as a whole have a different action on the body rather than the isolated compounds. And I was surprised to learn that the first journal of phytotherapy was only in 1997, so only 20 years ago. Balneotherapy, on the other hand, is the science of using water, mineral waters, and bathing in hot springs. It has been known, like phytotherapy, like herbalism, ever since humankind has discovered that bathing takes away pain, it heals wounds, it relieves emotional stress. There are countless legends everywhere in the world related to how the healing properties of different lakes or springs have been discovered, either through animals who were observed taking bath there, or people after battles, or every place has its own legends. And of course in our days there are modern applications of this age-old therapies, like sports injuries, or for the skin diseases, for immune system, for everything, depending on the place, and again depending on the coverage by insurance. I have written an article about how surprisingly Japan has the most onsen in the world, by far the most, and still there are only 200 or so balneology doctors in Japan. Hydrotherapy, as compared to balneotherapy, is referring to the internal also use of water for medical treatment. That means drinking mineral waters for different purposes. Climatology doesn't need any explanation, but again, referring to the Japanese Society for Balneology, Climatology and Physical Medicine, it is called. So it encompasses the Kiko, the forest therapy, it tries to make use of the large coastal area, Japan being an archipelago with so many islands and so much coastline. It is surprising again that the value of the ocean is not more used, and I have learned that it is because the fishery industry is opposed to developing the beaches for whatever, leisure or treatment as well. Regarding fasting and diet also, by the way, eating meat and how it is in Eastern Europe, or in my culture, which is Orthodox Christian, there are periods of the year where meat products are not allowed to be eaten, and this is called fasting. It is not as in Indian, when fasting is nothing at all. It is only animal products are restricted or completely reduced. So one of my ideas in life, I would like to study the health in monasteries, and it is the several factors probably would affect the health in monasteries compared to outside life. Not the stress reduction. I wouldn't say they don't have a stressful life, but the rhythm of life is different, and the food is different, and of course maybe prayer has also a role. And again, Gemmotherapy is relatively new science, but it is getting much attention because it is exactly combining the traditional knowledge with modern science. So it is proven that in the buds of trees and shrubs there are all the vitamins, the minerals, the enzymes needed for detoxification, cell detoxification, for cell repair, and they have particular affinities for different organs and systems. So it is very easy to apply them in specific health situations, and it's easy for Western trained practitioners to understand, and it is also based in nature, so accepted for people who don't want to try chemicals. Again, the medieval history of it with Hildegard von Bingen and Paracelsus and Hahnemann, and today's integration in the public health system is very different in different countries because of different reasons. But still, the bottom line is that it has been proven in various parts of the world that integrating natural health or traditional health or whatever you call it in public health systems is a very cost-effective, cost-saving healthcare models, both in terms of the objective disease-related measures and patient-centered appreciation of the treatment. And also, of course, as concerned effectiveness and efficacy and the safety and the quality of it is accepted. So, altogether, what I think is the root cause of many of our ailments in today's society is the disruption of the harmony with nature. People have forgotten to live with the seasons, and this is why I put these pictures. We are prone to having the same food and the same rhythm and the same time we wake up and the same lack of sleep all the year through. However, and this is a very big burden on human physiology. So just looking outside and adjusting the rhythm and food and to the nature would so much benefit our health. So your comments and ideas and comments are welcome. Thank you very much.
Thank you, Mihaela. Any comments or questions? It's a very broad topic to cover in a short time.
5 minutes.
Yeah.
Yes.
Well,
Thank you, Tim.
we've also heard earlier about body and mind. So again, I'm really into threes because one is absolutism, two is black and white, one or the other, right? When you add the third, then suddenly infinity comes into view, I think. And so the most infinite part of our being is our spirit. So do you classify your studies into body and mind or body, mind, and spirit?
Yeah, of course, body, mind, and spirit. You can't disintegrate the spirit of a person. At least a talking person. But even an infant, even a non-talking person has a spirit, of course. And
I was thinking of that 5-tier thing I put on the board there. At the top is the
yes.
emptiness,
Yes,
and that's
yes.
where the spirit would be.
Sure.
And like music, that's the one that we can't see,
Yes.
and so it often gets overlooked.
Yes. Of course, in evidence-based medicine, it is totally overlooked. It is non-existent. Yeah. Of course, it will be a long discussion
Yes.
why and who else mentioned why this paradigm is not accepted, because the homeopathy, for instance, or acupuncture doesn't work on 10,000 people who have the same, are supposed to have the same reaction to something. It is each and one has a different individuality and different totality, and it can't get any different from the haphazard result. You can't have a standard reaction. Nobody can predict the standard reaction to anything because everyone is different.
So if you get your wish to work in a monastery, you have a chance to work on those three.
Yes.
Any other questions or comments?
Yes.
Yeah?
In Japan, the Western medicine is recognized higher than the Oriental medicine, and but sometimes acupuncture is very effective for the stomach ache or everything. But why don't you think why it's that situation is happening in Japan?
I believe that it is because of the insurance system. The insurance system covers the Western medicine mostly, and even acupuncture, it doesn't cover the real acupuncture. It covers the campo, which is prescribed according to the symptom, not the syndrome. So of course it is easier for patients to go the least expensive way in first place, and also it is easier for the doctors to learn what they are taught, and they are not absolutely taught anything but Western medicine in medical school.
I see.
Like music.
For instance, but they are not taught nutrition either. So and nutrition is important also.
Yeah.
Is it the same for bioethics? Because
Exactly.
people are just taught Western bioethics.
Yeah.
Or about history of Japan, it forgets Ainu, for example, or so many
Exactly.
other countries. Any other questions or comments? Thank you very much, Mihaela.
Thank you.